Awesome. Welcome to the Myrna Method live stream. I'm registered Dietitian Myrna Haag. My goal is to bring you impactful nutrition information that can significantly change your life. So Sam, if we're ready, let's switch it down to the PowerPoint. Let's get this thing rolling. All right, this video, we're going to really drive home how food starts the disease clock. And most importantly, how we reverse that timeline. We're going to talk about the cellular fallout of a poor diet. And I'm going to really bring home the two big elephants in the room. Because when I'm referring to the disease clock, what I'm talking about here is age-disease relationship. Aging is a natural progression, and it's a decline in our physiological function. There's chronological age, that's your actual age, and then there's this biological age. And when I'm referring to the disease clock, it's this progression as we age, how much more prevalent we're going to be to disease risk. It's almost inevitable. And the next question you have to ask yourself is aging even a progressive disease? Well, I think so, because disease is a deviation from the normal function, an abnormal condition which can show in signs and symptoms, and it results in a decline in health. So when you think of aging, that's what starts to happen, because as we age, especially starting at 50, it can happen sooner. We don't like to think 40's aging, but typically at 50 is when we're going to get some of these hormonal shifts that are going to make it harder to lose fat and build muscle. The hormones are testosterone, estrogen, insulin, leptin. These are some of the circulating hormones. There's many more that just aren't what they used to be. We also have the aging process, which is the immune system declines, altered gene expression, cell damage. Now, we can have this at a higher progression or at a lower progression, but bottom line, it is a progression. So, yeah, in my opinion, I tend to look at aging as a progressive disease, and I think we need to treat it as such. Diet choices in your early adult life can affect your metabolism for later in your life. This is what I want to talk about in this video, is some of the things we did in our 30s and 40s are showing up in effects in 50s when we combine them with the natural progression of aging can make it a lot worse. The good news, though, even if you're aging, there's a lot we can do to reverse this timeline. So when I think about this disease timeline, and I think about the two things that I think are most important, are the insulin, are the factors that happen because of an imbalanced diet. Your diet is not balanced. You're getting weight gain, excessive hunger, belly fat. You have this excess insulin, and you're getting insulin resistant and also leptin resistant, which just means these are the two hormones that are going to make it really tough for you to control your appetite. But they have implications when you combine with aging, low estrogen, low testosterone, which leads to low muscle mass, increase in body fat. When the perfect storm comes together, you're going to have a higher risk for type 2 diabetes, type 3 diabetes, which is Alzheimer's, elevated lipid panel, which contributes to cardiovascular disease. And this is when we start to see the lifestyle disease diagnosis. So we can't control the lower estrogen, some of these hormones. This is something that's going to happen with aging. This over here is something that happens earlier with our food that accelerates what we're going to see with some of this aging and this clock. So what I like to look at this being the years, you can have it situated where aging can be more in your 40s and 50s, or possibly we remove the timeline and we're seeing something more like our 70s and 80s. In other words, we're going to have a decline. But the key is, what can we do to reverse that? We do not want an abnormal condition, which we know we're headed down that path. but we would like our timeline to be something happening more in our 80s and 90s, maybe even later. So when we're looking at what is the basic lifestyle factors that I want to drive home, and this is what I talk about, the two elephants in the room, because there's a lot on the internet and they're talking about different supplements you can take and fasting and all these things you can do, and they're missing the two biggest factors that contribute to increasing the disease risk, not slowing down the timeline, accelerating aging. So how do we reverse this disease time clock? Two things: balancing the macronutrients and maintaining muscle. These are two major impacts. And when I talk about balancing the macronutrients, I'm really going to be talking about protein, fiber, fats, and carbs. When I'm looking at protein, fat, fiber, carbohydrates, and how all of this matters, it matters specifically for the relationship in our diet. And I know there's a lot on the internet. People just make up what these macronutrients should be. And I want to show you in this video why the body wants you to keep these macronutrients at a certain percentage and how important it is for our overall health. And when these percentages are not maintained, how it can cause an acceleration in aging. So with protein, we want to have anywhere from 18 to 25% of our daily calories, which I'm going to explain will be with your ideal body weight. Fibers, anywhere from 40 to 70 grams. Carbohydrates, anywhere from 150 to 250 grams. The percentages are 45 to 55% for carbohydrates, and fats are 20 to 35%. Now, a lot of people look at this and they say, humbug, this is crazy. I can't eat that many carbohydrates. And there's usually a reason chemically why that can happen, which we're going to talk about in this video. So let's get the daily values taken care of. Let's figure out what your percentages, what your macronutrients should be in grams per day. Protein is based on your current weight. So if you weigh 200 pounds, we'll take 200 pounds and we're going to divide it by 2. Get my tools out. We take 200 pounds, we divide it by 2, and we come up with 100 grams. This is the amount of protein you need minimum a day. Carbohydrates, let's say you weigh 200 pounds, but you'd like to weigh 120. That's your ideal body weight. You multiply this by 1.3, and the amount of carbohydrates your muscles would like for you to have is going to give you a range. Now, easily you'll be maybe 10 to 15 grams in the lower, higher end of that range. And any extra exercise you do, you'll add more carbs to that. Now, a lot of people are freaking out over that because they're like, oh my gosh, I could never eat that many carbs and expect to not worsen my diabetes or increase my body weight. And this is what this video is about. I want to show you how that's misleading information that you're getting and show you the accurate information from a nutrition perspective. And fats, we want anywhere from 25 to 35%. So you take your ideal body weight, you divide that by 3, and you're going to come up with a gram. That's going to be based on 25%. You can easily add 20 to 30 grams to that, and your range could easily be 40 to 70 grams. Now, grams are what makes sense because that's what we do when we look at food labels. Percentages are really too tough. And if you're trying to figure out what your ideal body weight is, for women, for every inch over 5 feet, we take 5 pounds, we add it to 100 pounds. So if you're 5'4", it's going to be 4 inches. It'll be 120 pounds. You can easily add 10 pounds to that and still be within your ideal body weight. And for men, for every inch over 5 feet, it's 6 pounds, and we add it to 106. So why is this super important? Because macronutrients are being overlooked. And what a lot of people don't understand is they have a science behind them. So specifically, let's get right into fats. And I'm going to talk about fats in relationship to insulin resistance. Whenever you eat a carbohydrate, the sugar breaks down into the bloodstream with the goal of getting to your muscle cells and to the brain cells. These are the two main organs that really strive to get that sugar because it's important for them to function. Not that they couldn't go without it, but for optimum function, they would like to have it. But what happens with insulin resistance is excess fatty acids begin to accumulate in muscle cells. And these excess fatty acids are going to come from too much body fat or too much dietary fat, which goes back to the example when I talk about fats best at a certain percentage. Fats are required, they're good to have, but in excess fats can be a problem because it's the excess fatty acids that accumulate in the receptor site. So when insulin attaches to the receptor site on the muscle cell, it talks to a messenger who talks to another messenger, brings up the transporter that allows the glucose into the muscle cell. But what can happen is when that receptor site becomes disabled because of too much dietary fats, too much body fat, this messaging doesn't happen. The receptor site is defective, it's disabled, the transporter doesn't come to the surface, and the sugar builds outside the muscle cell, and fat cells will easily take in the sugar. And as the fat cells do that, they also come somewhat defective, and they can release more fatty acids into the bloodstream. So bottom line, with insulin resistant, it is a function of excess fatty acids that circulate into the bloodstream for two reasons: too much body fat or too much dietary fat. And then we have a condition called lipid toxicity. This can be from healthy fats, olive oil, nuts, avocados. These are all really good fats, and these are the kind of fats you want to be eating. But it's understanding that these macronutrients have an optimum percentage. The percentage for optimum fats is anywhere from 20 to 35%, not 45% or 50%. Now, once again, there can be other clinical conditions that can take place that can change this. I'm talking about the average person. Now, what can happen is that when you have a situation where you have these receptor sites that are clogged, and I've talked about this in other podcasts, this can increase the insulin in circulation. And when insulin increases, you're going to have an increase in hunger, you're going to have an increase in the glucose, you're going to have an increase in the insulin, and this can contribute to weight gain. So insulin resistance starts out with not understanding that these macronutrients have a preferred balance. And when I look at the timeline, what I'm really trying to bring home here is that a lot of this balance in the diet that's an unbalanced diet that increases weight gain, excess hunger, excess belly fat, excess insulin, this is all insulin resistance, which drives the point home that it's from a diet that's not balanced, that we're not really looking at the importance of why these macronutrients are best at certain percentages. And when they're not, this is an example how it can contribute to insulin resistance. Excess fatty acids that circulate from too much dietary fat or just too much body fat, and both. So when you lose a lot of weight and you lose a lot of body fat, your laboratory values will increase because you're going to have a less excess circulating fatty acids. But it's literally a short term unless you can get your diet balanced, because it'll be a short term because you're losing a lot of fats from the less body fat, but it still comes down to understanding how to balance the fats correctly, getting the right amount in your diet. Now, these fats that are changing from a fatty acid, they accumulate into that receptor site. They then differentiate to a type of fat called a ceramide. And this type of fat circulates, and it can cause damage to heart tissue, kidney, pancreas, brain cell. You can go to my YouTube channel. I have a podcast I did, YouTube just on ceramides, what I call the silent killer. So why I'm talking about this and why I feel it's important is because as you age, macronutrients and understanding the balance of these macronutrients are important because they help keep the body in a homeostasis. Fats, which are one I talk about a lot, it's important to keep the percentages where they need to be. But also it's important to understand that carbohydrates serve a purpose. When carbohydrates are depleted from muscles, muscles want a certain amount of carbs. I talked about that when I explained how you get your ideal carbs for muscle. You take your ideal body weight, you multiply it by 1.3, and that gives you an idea of the amount of carbs that muscles would prefer to have on a daily basis. It's not an excessive amount of carbs, it's the realistic amount. When muscles do not get the amount of carbs, yes, you can use just fats to burn as fuels, but it's not optimal, especially for active muscles. And I would assume most people would want to be active, but also the other problem is when the glycogen levels, when the glucose levels in the muscle become depleted, it does deplete the muscle from water, because for every gram of sugar stored in a muscle, you have 3 grams of water. So when you go on a low-carb diet, you're also dehydrating at a cellular level. That's why they're called carbohydrates. But from an addiction standpoint, food addiction, when you have low glycogen levels, there's also a situation when the carbs get low in the muscle, they trigger the brain to crave more carbs. I see this with a lot of my patients. They eat a low-carb diet because they have insulin resistance, because they are not good at getting sugar into the muscle cell. And so what they do is they eat a low-carb diet, and this makes it worse. What we want to be able to do is balance the macronutrients, understanding that carbs are an important part of your diet, and by eliminating them, the brain will really trigger you to the hypothalamus, the appetite center in your brain will trigger you to crave more of them, which is why a lot of times people eat a lot of calories, but then at night they're searching for the little snack that turns into not just 1 granola bars, 3 granola bars, and that's muscles wanting their carbs. Protein's super important because if you don't get enough protein, your body eats into your muscle tissue. And this can happen after 16 to 24 hours of inadequate protein. So I think of fasting. A lot of people are fasting because they're trying to make their muscle cells more sensitive to the insulin. But really, the hormone insulin, the problem is we've got too much fat. So when we're really looking at balancing a diet, we want to make sure we get enough protein and we get the right amount of fat. And then the other macronutrient that's super important is fiber. We want anywhere from 25 to 35 grams minimum. I like to see my patients at 40, but 35, I'll take it. Fiber cleans the intestinal tract. It makes good bacteria. It makes chemicals that circulate the body, these short-chain fatty acids that travel to other areas. They have receptor sites on immune cells. A lot of our cells in our body depend on short-chain fatty acids to create and promote health. So they're little chemicals that are made from fiber in the gut. So the important thing is understanding that these macronutrients, protein, fiber, carbs, and fat, are truly important to keep at percentages and understand how to balance them for your day. And when you have a problem like insulin resistance, which can start as early as in 20 and 30 years old, you start developing a situation where this will, over time, be type 2 diabetes. Because when enough of these receptor sites become clogged, then you have more and more glucose building in your blood, more and more insulin. Knowing that the root cause is because too much dietary fats, we're not balancing those fats, and we're probably eating too much glucose, for sure, too much carbs, because we have this insulin surge, which can also make us hungrier. But the importance is understanding when we have this combined with what goes on normally with aging, which we're going to now talk about with aging, the loss of muscle. And this is another factor. Two important factors when I talk about lifestyle and aging. The two big elephants in the room nobody's talking about is balancing the macronutrients and the importance in doing that, and maintaining muscle as you age, because you will have a decline in the hormones that help maintain the muscle. But as you age, when the two perfect storms come together, the insulin resistance and the low hormones, the hormones that are declining, this is where you really see the acceleration in aging. So when we look at what are the two major important impacts that we can do, it's going to be to balance the diet and to also not allow that accelerated muscle loss. The other thing with muscle that I talked a lot about, I think 2 weeks ago, you can get it on the live stream, why muscles is the immune system, the secret weapon, is how muscles are highly implicated with our immune system. It's a great podcast to watch. I go in much greater detail than here, but muscles create chemicals, many different types. They create protein-like hormones. Immune cells are triggered, neurotransmitters. These chemicals that are triggered from your muscle, and it means having more muscle means more health. Less muscle, less health. And I think the point I really tried to drive home is a lot of times people can be active, but they may not, as they age, really be developing enough muscle mass. And I use some examples of my patients. I use an example of my patient Sandy, 67 years old. She's at her ideal body weight, but her body fat should be under 28%, but she's 36. She's actually fatter at her ideal body weight because Sandy's muscle mass is less than it should be. We would like to have everybody be at 100%. And Sandy is down to 69, 70%. We want all her muscle in this machine that I use, in-body machine that can measure that. I see a lot of my patients as they age and they're at their ideal body weight and they're active, they're still not generating enough muscle. So with this patient, particularly, is the example I'm using, she's at her ideal body weight, but she's 18 pounds over fat. She's 13 pounds under muscle, which means she's 25 to 30% less muscle than she needs to be at her age to get that immune system through the muscle where it needs to be. So if we can correct the muscle, and this, by the way, is what I refer to skinny fat, right? We have a lot of marbling in that muscle. But the point I'm bringing home in this video is the two major factors is balancing the diet. And I know we can eat a healthy diet. Avocados are healthy, nuts are healthy, but it's the balance of these macronutrients and the fact that increasing the muscle mass is what can really affect the timeline, this disease clock. Because as we age, it's a progression. It's a progression of decline. But we want that to happen. We want our timeline to look more like this than we want our timeline to, when I say this, in case you're listening, we want our timeline to look more as if the lifestyle disease, the diagnosis are occurring much later in life in our 80s and 90s than occurring much earlier in life than in our 40s and 50s. So what really drives this home is two major things. And I'm not saying that some of the other things aren't as important, but these to me are the big, I say elephants in the room because these are the two things that people aren't really focusing on. They're picking some supplement and and we don't even know if it's working, or they're fasting, or they're doing a lot of things for anti-aging, when really a lot of what's going on is they're just not balancing the diet. which has little to do with eating healthy. We want you to eat healthy, but we want you to understand that balancing these macronutrients are super important for your health. And then also maintaining muscle. And the only thing I can really say about muscle is it takes resistance. It's about intensity. When I think about my patient Sandy, she's active, she plays a little golf, she walks her dog. After all, she's at her ideal body weight. She looks great for 67, but she's not putting enough intensity into her muscle, which would be weightlifting or adding, if she was going to walk, it would maybe be more intense. She'd have to do some squats. She'd have to do things that make that muscle basically burn. So, and it doesn't really take much. I'm actually working on doing a little study with some patients. Hope to have 200 patients by the end of the year using this InBody machine and really being able to get back to you guys and tell you exactly, based on the data of all these patients, how much exact muscle intensity did it take. I'm finding literally 20 to 30 minutes 4 times a week with some weights is literally enough to boost the muscle mass on most people. So we're not talking about hours at the gym, but a game of golf or walking your dog is not clearly enough as you age, because we are reducing the hormones that allow us to build that muscle. And also when we have insulin resistance and insulin doesn't work like it should, that can also reduce muscle mass. And let me just make a point here that I do make in some of my other videos that I want to talk about here, is that when insulin is not able to function like it should, it does decrease protein synthesis, and this can also affect building more muscle. So insulin is an anabolic hormone. It helps us bring sugar into the muscle, but it also helps us build muscle. So when you have an insulin resistance and you tie it with aging and you're at higher risk for type 2 diabetes, it means you're also going to have less muscle. It's all tied together. So in summary, hopefully what you got out of this video is the importance of balancing the macronutrients and maintaining muscle to reverse the disease time clock. So Sammy, if we have anything on the chat, let's get to it.
I don't think so. I think you're good.
Okay, awesome. Like and subscribe. Thank you. I appreciate all the followers. Makes me work harder to make you better. Till next week.
Should be good.
All right.
Okay. Oh, let me get it. All right.
Okay.
Here.